Back in July last year, there was a patient who was in a real bad way. Well, actually, I heard him like outside. I could hear him in a lot. Just me here, he was sitting outside. I could just hear him. Someone's in a lot of pain. I didn't know who it was or what the problem was, but you can just hear him. And then when he came in to the room, he was all bent forwards. So he was really antalgic. So he was leaning across, really bent forwards and leaning across to the right side. Okay, so I had a feeling it's got to be a disc. It's going to be a really bad disc bulge. That's what's happened. Okay, so once I did the history, I found out that he's had previous problems like this before, previous disc injuries. He was playing badminton, and that's what set it off in the first place. The following week, he did a bit of jumping. Okay, so the jumping actually further aggravated the low back to the stage where when he actually came in to get him onto the side posture table, he had to have 2 friends to help him to get onto the side posture table. Just the way that he was presenting, he was sweating, you can just tell he was in a lot of pain. In terms of the treatment, what I did was, he had a real bad disc bulge, and so obviously I needed to find out which area was causing the problem. And I can see there's a lot of swelling on a certain part of the low back. So I needed to do the adjustment, and it was hard getting him to change direction. So what I did was I tested him on one side, and because he couldn't really take that side, so I had to switch him over to another side to actually get the adjustment. As soon as he had the adjustment, I could see that when he got off the table, he was actually doing better already. He didn't have to have the 2 people holding him side by side. Okay, so I knew that there was a positive change for him. Now, as we went further and further through the treatments, he definitely started to respond. Okay, so he would have some days where he's bad, but most of the time he was definitely starting to be more upright, and he's definitely saying that he's not taking the painkillers that he was taking before, and he's able to sleep better, he's able to sit a little bit longer, and definitely better walk a little bit further. He definitely started to show good signs overall. The bad thing that I could see from his MRI was that he had multiple disc bulges. He had disc bulges on L3, L4, and especially L5. The L5 disc bulge was really big. It's one of the larger ones that I've seen. After the adjustments, because I didn't see him for a few months because he went back overseas, he did actually have another MRI, and he actually sent that MRI across. Now, in terms of comparing the before treatment and after treatment MRI, which was taken at least a few months apart, not even like pretty much a year apart, I could see that the disc bulge has been reduced. And this is not something that I've done as a procedure, like to take before and after MRI, but I can definitely see in his case that there was a good result. I can see that he was definitely, in terms of the symptoms, much improved. And also the MRI was better. The disc bulge on that L5S1 definitely looks like it's not as big as it was before.
Do you have any message for patients who have the same cases as yours and have been asked to physical therapy and surgery? Do you have any advice to them?
Sure, the first advice is don't ever lose your hope, because there is a solution for everything, and the solution is not surgery. Really, for me it's not surgery, and I believe everyone else does think the same, because surgery is the last option. There are a lot of options, and for me this option, the chiropractic, really works. So I offer everyone, even though people don't have any problems, I believe that they have to check them up here in chiropractors. So that's good.
And would you recommend chiropractic treatment?
Sure, 100%.
Okay, thank you so much.